Even Pat McFadden literally won't say the word savings as a welfare secretary. I pushed him on this in Parliament last week when we had departmental questions. As Rachel Reeves as Chancellor and Keir Starmer as Prime Minister, still talking about welfare and saying that they need to do welfare reform and savings, but their welfare secretary won't talk about savings. Our backbenchers won't talk about savings. They just published their big review that they're going to do sickness benefits, and they ruled out savings in that. So there is this extraordinary split going on between Keir and Rachel at the top, trying to talk about it, but actually they haven't got the backing of their party for doing it.
1 in 5 new cars is a Motability vehicle. You said in your conference speech, which I've got here, we need to stop the abuse of Motability. We need to put British citizens first in our benefit system. How are you going to do that? So specifically with Motability, would you scrap the whole thing? Yeah,
let's jump right into Motability. Though to me, that exemplifies what's gone wrong with our welfare system. It's like a really good or bad case study, as you see it, where you've got a scheme that was set up to help severely disabled people be able to get about. Thinking of people, for instance, who had double amputations, those kind of serious disabilities, and would need an adapted vehicle. And that was conceived, and it was all set up in the 1970s, and for much, much smaller numbers of people. Now, as you've just said, like 1 in 5 new cars are Motability. The numbers have skyrocketed, and just last year, 3 billion was spent on Motability. That's a 10% increase just in the last year alone. Something is going very wrong with that. And then if you get into the data, we're seeing that people are getting a Motability car for all sorts of reasons, and tennis elbow and acne. And
yeah, we've covered some of that. Yes, extraordinary.
But larger numbers on, for instance, ADHD. Now, I recognise ADHD as a thing. I have members of my family who have ADHD diagnoses, but that's not a reason to be getting a taxpayer-funded car. So that's one of the things that I've said, that we have set out a plan to reform welfare, and one of the areas we would reform is Motability, and very specifically, you're not to be able to get a Motability car if you don't have a severe disability. And things like ADHD, anxiety, those should not be reasons for getting a taxpayer-funded car.
Do you think that medical evidence should be required for every single PIP claim? Do you think that we need to return to in-person assessments and really crack down on that in quite a significant way? I mean, how far would you go on that?
So we definitely have to reform the way that the process works for getting sickness benefits, because that is where the gateway, as it's called by people working in that area, is not working. You've got far too many people, although you will also have people who are disabled saying that they still struggle to get their PIP. So the process is not working. One way in which is very much not working is the shift away from face-to-face assessments, those being done over the phone. Clearly, that happened in the pandemic. It made sense in the pandemic. You couldn't have people who had who might be very sick going in for assessments in person, but it should be going rapidly now right back to being face-to-face. And even if somebody can't get out of the house, they should, as it used to be pre-pandemic, somebody would go and visit them to do their assessment.
Yeah.
Because being able to do it over the phone, I mean, the fact is we know, and if you're looking online, there's the 6 Forensic videos, the scripts, you can even pay for a service which will tell you what to say over the phone for getting your assessment. And I've been to PIP centres, I've spoken to them about the process they do, and there really isn't a robust way of checking as to whether somebody really has the limitations that they might set out in a phone call.
Yeah, so we say in-person assessments, but what else? Because the welfare bill is absolutely exploding, and actually is it's not just under this government. It went up. Of course, you had the pandemic. I understand that, but do you not feel you need to be really radical? So do you have any radical ideas?
Yes, to being radical. Unless, as you say, I know it went up through the pandemic, and this rise, particularly in mental health claims, did start when we were in government, because it's a product of the recognition of mental health alongside physical health. And actually, we've got a sickness benefit system that wasn't designed and conceived of in a world when that...
So some of that was necessary, you think?
I don't think it was necessary, but I think it's an unintended consequence of what's set out with a good ambition of improving mental health care and recognising mental illness, and rightly so, but unfortunately it's had this consequence in the sickness benefit system. It's not working. So yes, I believe it needs radical reform. Where I am at the moment on working that up is I've set out a set of plans, which I think the things that the government should do here and now, and then I'm continuing in parallel to work on the really fundamental reform of the system. So what I've already said, and I said this at conference, and Kemi's covered it in some of her speeches, is there's no very specific thing of you not being able to get sickness benefits for common or low-level mental health conditions like anxiety, like lower-level mild depression, or like some aspects of neurodiversity like ADHD. That is a very specific policy that the government, I think, should get on and be doing. There's been quite a lot of work done on that by think tanks like the Centre for Social Justice. So that is clear. They should get on and do it. They should get on and make changes to Motability. They should get on and be making all assessments face-to-face. They should be getting on and reforming the sick notes or the fit notes. That's work I started when I was in government, and then they cancelled, Labour cancelled it. So those are things they should get on and doing here and now. And then, yes, in parallel, I'm working on a more fundamental reform of how do we get the sickness benefit system to work better, looking at, for instance, a question of to what extent should people get money, to what extent do they need adaptations, to what extent do they need access to services. But what I can say for sure is it's not working now and it needs to be different.
So the timeline for this parallel work, this ongoing, more radical work that you're doing, do you have any specific dates and milestones for when we can see this stuff, or is this just over the next couple of years you slowly roll out and introduce it?
Yeah, well, I take the view that by the time the next election comes, we, the Conservative Party, need to have a really substantial plan for what we would do in government and set out to the country. If you elect us, this is what we will do. That, to me, is a sharp contrast to the situation that Labour is clearly in now and when they were elected, which is they turned up and they hoped that the civil servants would give them the answers, and found that civil servants looked at them and said, no, you guys, you've just been elected, you're meant to have a plan. So they didn't have a plan. I want us to have a plan ready for government. Kemi Badenoch wants us to have a plan ready for government. But that involves, hard work. It's not going to happen overnight, which is why we've set out, started for 10 stuff that they should do here and now, but we'll continue to work on that over the next couple of years because we need really substantial reform, and that takes a hard yards.
Now, one area that you might look at, but you said already that you're not comfortable with going towards, is the triple lock. You're going to keep the triple lock. Now, according to the OBR, the state pension will cost 7.7% of GDP by the 2070s, or 140 billion last year. It's an enormous, enormous bill. Why keep the triple lock? Surely it's outdated. It was introduced in 2012, and now look where we are and look how much it's costing. That would be a huge, huge benefit to you, surely.
So as Kemi Badenoch said, and I've said, our policy at the last election was a commitment to the triple lock. That is our conservative policy. Yes, in the work I'm doing, I'm clearly looking at pensions. The thing that I'm particularly doing a strand of policy work on is about the challenge of people overall not saving enough for later life, not saving enough for old age. Even with auto-enrolment, people are likely to find that when they retire, they actually are not going to have the income that they expected. The other thing that's going on is related to this is people not managing to save for whether it's a house deposit or a kind of rainy day situation. So I've got a piece of work looking at how do we shift towards having enough savings and investing your savings in a way that gives you a decent return so that you'll be able to afford the standard of living you want in old age or the potential big costs. To me, that is the bigger, really important piece of work for us to do in opposition. That's where I'm particularly spending my time on the pensions.
But I'm still not clear on why keep it. I suppose you could argue there's a political incentive to do it because Conservative voters like it. But are you not prepared to be unpopular and take the decision that is maybe to the benefit, to your fiscal advantage, rather than to an immediate political advantage? In other words, are you being penny wise and pound foolish?
Well, I mean, I'll show you in terms of the work that we're doing on policy, we're going to be driven and are being driven by, what is the right thing to do for this country, recognising the difficult economic situation that we're in. I mean, that's one reason why I'm so motivated on identifying welfare savings, not only because I think it's wrong that so many people are not working who could be, but also because financially
Yeah.
We have to make the tough decisions to be able to have a stronger economy. So that is the way that we are looking at things. But again, it's not a question of easy answers, and it's not a question of just trying to be popular. It's coming up with what is the right answers for the country.
So last week, Reform announced their opening pitch for reforming welfare. What was your impression of those set of announcements? Zia Youssef and Lee Anderson together talking about similar things you're talking about with PIP and mental health and those common illnesses. Are you in alignment with them on those sort of areas?
I would say more the other way round. So if you look back over what Reform has or hasn't said about welfare over the last year, they came out saying that they were going to lift the two-child benefits cap, which will cost billions of pounds. So they came out with basically a signal of a big spending commitment that they would do expanding the welfare state. And then the next thing they said a few weeks ago was about restricting benefits, not giving benefits to people who weren't British. Well, that was our policy that we were working on. They got it a bit wrong when they announced it and had to change it rather a lot within a matter of hours because that was our work. And then the thing that they said the other day about common mental health, well, we've already been talking about that. And anyone who looks, I've been talking about how we need to stop giving benefits for low-level mental health things for months now in public. And they picked up, it's a slightly watered-down version of what I said. They're not as ambitious as we are on welfare, but all they are doing is picking up a subset of policies. So to me, this encapsulates Reform is they're trying to get headlines,
right?
But they're not doing the hard work. They're just they're copying my homework basically. But no, you've got to do the hard work. They need to be able to come up with their own ideas if they're going to be a serious contender, and they're not.
But you must see them in the polls and think, well, why are they getting all this attention and what can we do to win that back? Is it frustrating that I can see that you're really enthusiastic about this and you're saying they're stealing your homework, and yet the polls trend in another direction. So what are Conservatives doing to turn that around more broadly, do you think?
Well, we're not spending all our time thinking about them. And the thing I spend my time thinking about is what can I do as the Shadow Secretary of State for Work and Pensions to get the country to be in a better place in the areas that are within my brief. I mean, I asked to do this brief because I really, really care about the waste of lives of people not working, about the fact that the economy needs people to be in work, and about the fact that we shouldn't be spending billions on welfare, particularly for people of working age who could be in work and we can't afford that. I'd much rather us make tax cuts and have a stronger economy. That's what motivates me, is fixing that. And on the one hand, holding the government to account and trying to genuinely get the government to do a better job. I mean, I hate the fact that Rachel Reeves is on her way, it looks like, to putting taxes up again in the budget.
Yeah.
Really bad for the economy. I hate the fact that we're seeing unemployment go up month on month. I hate the fact that there's 1 million young people who are NEET, not in education, employment or training. These are really bad things for our country, bad things for my constituency area that I represent. I mean, heck, I've got teenage kids who are going to be wanting to get jobs in the next few years.
Yeah.
I want there to be a good economy for them to get opportunities in. So I really care about that. I want the government to do better here and now, which is why I'm being completely open about these are the things the government could or should be doing. Literally saying to government ministers, come talk to me about this, along with doing, as I said, the more like the deeper work and the really hard yards on more radical reform that we could offer at the next election.
Yeah, so it's interesting you mentioned that. So I've got Kemi Badenoch's speech from, I think, September, when she said, she, along with you and the Shadow Chancellor, Mel Stride, offered to work with Labour on reforming welfare. So we took difficult decisions and Labour hated and voted against each one. We reformed welfare so millions more could get into work. And she goes on to say, let's extend a hand. So when that speech was made, what was the reaction? Was there any sort of backstage politicking or any sort of discussion with the Labour Party at all, or was that totally ignored, that outreach?
I mean, I've had a meeting with Pat McFadden, the relatively new welfare secretary, and we talked about this, but he's not been forthcoming, and the Labour Party hasn't been forthcoming in wanting to take us up on our offer.
Which isn't much of a surprise, I suppose. They are your opposition, right?
Well, yes, but the problem they have is their backbenchers are very strongly against welfare reform. So when they tried to make savings, and 5 billion, not anything like the extent of savings that they should be making, but when they tried in the summer to do that, And backbencher after backbencher, Labour backbencher after backbencher stood up and said things like, I didn't come into Parliament to cut benefits. Like, they are so against making savings, they're backbenchers. I mean, even Pat McFadden literally won't say the word savings as a welfare secretary. I pushed him on this in Parliament last week when we had departmental questions. He won't use the word. And actually, you've got this extraordinary situation as Rachel Reeves as Chancellor and Keir Starmer as Prime Minister, still talking about welfare and saying that they need to do welfare reform and savings, but their welfare secretary won't talk about savings. Our backbenchers won't talk about savings. They just published their big review that they're going to do of sickness benefits, and they ruled out savings in that. So there is this extraordinary split going on between Keir and Rachel at the top, trying to talk about it, but actually they haven't got the backing of their party for doing it.
Yeah, it's a big, obviously you can see it's a big problem for Rachel Reeves. She's completely boxed in. I'm interested in when you have these private conversations, so perhaps you won't reveal everything, but I'll try anyway. When you spoke to Pat McFadden candidly, was there any sort of any leeway on his thinking? Did he give you anything?
Well, I'm not. I mean, it was an informal conversation, so I'm not going to.
Well, it wasn't.
I'm not going to.
It was an hour-long interrogation.
Verbatim. But I think Pat's was well known for being a pretty wily operator, so he's not going to put his cards on the table. But as I say to him, as I said in Parliament itself, I push him on it, and he doesn't want to talk about savings.
He doesn't want to talk about it at all. Let's just return to that Kemi speech, because there's a second part to it. We brought down the deficit every single year until the pandemic. It's talking about reforming welfare more broadly. I'm not saying we did everything we did was perfect, because if it was, we would be in government. That's a fact. So what were the things you think that the Conservatives got wrong, specifically on welfare, when you were in government?
Well, you might let me start with briefly something that we got right,
Sure.
Which was clearly when we came into office in 2010, the economy was in a really bad way. And that was when Ian Duncan-Smith led the work on introducing universal credit, because up till then, people benefits were incredibly complicated. It's very hard to keep track. And there was this fundamental problem, therefore, that work didn't necessarily pay. Universal credit was introduced to change that. And I'll come to it in a moment of what's happened since then, and clearly the benefits bill going up. But that was a very effective way of simplifying the system. It actually also enabled lots of savings to be made with DWP itself, and to save billions from the cost of running DWP as a department. So that was very successful. Unemployment came down. The benefits bill actually came down during that period. What then happened around the time of the pandemic was this rise in people claiming sickness benefits for health reasons, and particularly the number one reason here is mental health. So I think this is an unintended consequence of the work, and I was involved in this as a mental health campaigner, to try and get mental illness recognised as something that was serious and should get properly treated, and shouldn't be something that people would try not to talk about. There was a huge stigma in talking about mental illness. So people like me, a campaigner, that were trying to change that, thinking particularly about the stigma around whether it's schizophrenia, psychosis, things that are serious mental illnesses, and to get people to talk more about, say, depression. It was okay to talk about your mental health struggles, but the unintended consequence of this has been the surge in people claiming sickness benefits for these reasons. And in fact, some figures out literally yesterday saying that the majority of people who are young people who are claiming, who are not in education, employment, training, their needs, that's to do with ill health and disability. And obviously the largest driver of that is this mental health problem. So this is an unintended consequence.
Right, so it's kind of an overcorrection, you think?
Do you know what? I think there's more work to do to understand really what's going on. And I'm not... No, I do loads of visits, and I speak to whether it's employers, whether it's job centres, whether it's charities, and they talk genuinely about a generation of people who are struggling with anxiety, really incredibly worried about whether it's coming into the job centre, whether it's going to an interview. So we've got to get a grip of this. we've got to make sure that you've got a generation of young people who are hungry for success, who want to get out there, who want to make something of their lives, who want to contribute, because that's the right thing for individuals and our economy. And goodness, in the society we live in, there are other countries where people are really hungry to make their lives better, and that will boost their economy and that will boost their country's prosperity. We need to be like that too. We need to be hungry for it.
I've got another stat here for you. So we've given foreign nationals, we briefly touched on this earlier, £25 billion in universal credit payments since 2022. Obviously, the Conservatives were in government until 2024, so a portion of that rise was under the Conservative government. So how did that happen?
To continue listening to this interview, become a member now by heading over to order-order.com.